Good morning. I'd like to start by acknowledging that May is Myeloma Awareness Month, and on the 28th, which is this weekend, it's World Blood Cancer Awareness Day. Welcome to our webinar, Blood Cancer and the Brain. I'd like to start too with an acknowledgement to country. The Leukaemia Foundation acknowledges the traditional owners of the various lands from where you are viewing today. We recognise their continuing connection to the land, the sea and the community. We pay our respects to the elders, past, present and emerging. My name is Linda Thompson. I'm working alongside my colleagues, Jenny Burke and Linda Saunders, and we'll be facilitating today's webinar. So we frequently hear from people living with blood cancer that they experience a kind of brain fog or feel their memory, thinking, concentration has changed since diagnosis or treatment. These symptoms can cause frustration and make everyday activities more difficult, like managing figures and finance, multitasking at work, driving, and even our relationships. So, is it real? And what is going on? Will it go away, or do I have to learn to live with it? We have asked a panel of experts to answer these questions and hope you gain relevant information you can use to make things easier for yourself. Our hope is the more informed you are, the better equipped you will be to continue to adapt and live well with any changes in memory and thinking you experience. All right, so to convey the reality of living with the blood cancer and the impact on the brain, I would like to share with you a little of Mel's story. So Mel was diagnosed with myeloma in March 2015 with a fractured vertebra and ribs. Since her diagnosis, Mel has experienced many different treatments, including chemotherapy, 2 stem cell transplants, a donor transplant, radiation treatment, and many targeted myeloma drugs. She has generously shared with us some of her challenges, strategies, and key learnings related to living with cognitive change, colloquially known as brain fog. We will now watch a short recording of Mel as she talks about the daily experience of living with the fog associated with cancer and its treatment.
Hi, I'm Mel. I was diagnosed with myeloma 7 years ago at the age of 48. At the time, I was a fit and healthy mum and working as a physio. So over the years, I've had quite a lot of treatment. I've had 3 stem cell transplants, one of which was a donor transplant, radiation, and lots of treatment drugs. And the main impacts physical impacts that myeloma and some of the side effects have had on me are mostly bone issues, fatigue, and certainly cognitive difficulties. And so that's what I'm talking about today, or chemo brain, as we often talk about it. So chemo brain, I think, is really tricky because it's something that we experience, but others don't necessarily realize that we're actually struggling. So sometimes, we can be having a conversation with our friends and we might look all right and seem all right, but actually our brain is really having a hard time. One thing I've noticed over the years is that my chemo brain problems fluctuate. So I don't know if that's related to, fatigue or whether it's just related to, having a lot of other things going on at the time and maybe being a little bit overwhelmed. So I noticed, particularly post-transplant, some of the issues that I had included difficulty concentrating and focusing. So for me, who's an avid reader, I really struggled with reading a book. I'd choose the easiest read I could find and still not necessarily be able to get through that book. Driving was really challenging because of my lack of concentration. So for quite a while, I was only able to drive 15 to 20 minutes. Even now, whilst I'm on treatment 3 weeks out of 4, I only drive the longer distances of, an hour or so on my week off. So it still, has a a significant impact on me. Slower thinking, and sort of processing speed of my brain. So I didn't actually really realize this until I was speaking to someone else and I could see how quickly their brain was working. And I realized I used to be able to think like this. So it was actually quite devastating to realize that. Um, yeah, so that was one of the things. Planning a meal. So, as a mum, I've been doing this for years, but this was really challenging to be able to even think of how to put together a meal. So I just, tried the easiest food I could get. Um, Even planning a day. So, you know, I was struggling to work out and get through the day. So normally, we might write A, B, C, and D down on a list and then, okay, go, great, this is what we're doing today. When I was probably at my worst, I'd write down A, B, C, and D, but then I would need to keep going back to that list to consult it to make sure I was on track. And so I could work out what was next. Really quite bizarre. Following conversation. So I'd be chatting away with friends and I might look like I was following a conversation, but my brain would be going elsewhere. And then I'd lose track of where we were. So that was a little bit tricky. Memory. Again, with memory, I can remember names and, a lot of things. But it's only when people start talking about certain incidences or things in the past, and I have no idea what they're talking about, that I realize there are parts of my memory that are affected. And that's really quite bizarre because I can't really pinpoint. It's not like it's short-term memory or long-term memory. It's just sort of parts of my memory. So I'm not really sure what's going on there. Word finding. This can come and go. A lot of us, can experience this as well. But I think it was more profound after the transplant, just trying to find the words to spit out. So particularly after I realised how slow my brain was working, that really motivated me to get going and start working on improving my capacity. So I started doing things like juggling. I didn't persist for very long because I'm terrible at juggling, but using my non-dominant hand, so doing normal things but doing them differently, just to challenge all those pathways in my brain. I tried learning new things. I learned the ukulele, and more recently I've taken up line dancing, which is great. And the thing about learning new things, I think it's really important to choose things that you enjoy because it, for one, makes it easier to learn, and also you're enjoying it at the same time. I did a whole bunch of free online courses things that interest me. And the great thing about online courses is that the free ones, it doesn't really matter if you don't finish them, which is good. When I use my phone, I tend to use my non-dominant hand now. And when texting, rather than using predictive text, I actually type out the full word. So I found that really helpful in just getting my brain working a little bit more, and it also helped with my spelling. Last year I started a course at TAFE, and the idea was to challenge my brain with a different type of learning. So my background is in the health field as a physio, but I took up a course in accounting and bookkeeping, which is totally different and totally different way of thinking. And I actually found that really helpful. I could feel how my brain was changing and how it was starting to think a little bit differently. And I was, yeah, doing really well with that for a while. Something that I've found also quite helpful over the years is meditation or mindfulness. Like there's lots of different ways you can do this. But particularly when feeling overwhelmed, which you can be when your brain isn't working as well, I found just tapping into that meditation or mindfulness, type of thing, just really helped ground me and just sort of, yeah, help settle things down. Um, they say it's supposed to help with, help with your thinking as well. So I believe so. Yeah, perhaps that did. What else? Memory. Have I said memory already? Well, that's funny because my memory is terrible. Oh yeah, I have said memory already. Yep. So they're the main things. Just one other thing that I think that's really helped me is just accepting how I am, the way I am at the time. So because I find my chemo brain fluctuates, over time, I've found it important to just make sure I accept where I'm at. And, if I'm struggling with something, well, I'm struggling with that, and that's okay. So just being kind to yourself and just accepting the way you are. And then, it's just a matter of just continuing to adjust. It's not, or it doesn't, it's all a roller coaster ride, just like myeloma. Um, and so are the side effects. So I hope just sharing some of my struggles will help you. You may or may not have, uh, experienced any, or you might have experienced some of them, or maybe you've experienced them in a different way. But yeah, I hope that's helped. Okay, thanks.
Mel has beautifully summed up some of what people in research tell us about some of the problems in thinking, memory, recall, concentration, and processing information quickly. To take a deeper dive into what might be happening and why, we'd like to introduce Professor Janette Vardy. Janette Vardy is Professor of Cancer Medicine at the University of Sydney and Medical Oncologist at Concord Cancer Centre, where she is Director of the Sydney Cancer Survivorship Centre. She founded and co-leads the University Sydney Survivorship Research Group and with Associate Professor Harena Dehelen. She is supported by a National Health and Medical Research Council investigator grant, and her research interests are focused on survivorship issues, in particular cognitive function, exercise, and multidisciplinary delivery of care. Take it away, Janette.
Thanks very much, Linda. So it's a pleasure to be here today with you. It was actually cancer survivors, in particular breast cancer survivors, who first brought to the medical profession notice about this problem of cognitive symptoms. And it was them that coined the term chemo brain, or as you'll come to see, hopefully from what I present, what might be better is probably cancer fog. So studies have shown, and again, nearly all of them are in breast cancer, but that almost all survivors will report that they have some cognitive symptoms whilst they're undergoing chemotherapy. Now, for most, they will improve with time away from chemotherapy, particularly say 6 to 12 months after finishing. But a number of people report that they improve maybe up to 70 to 80% and then seem to hit a bit of a plateau, so that symptoms may persist after chemotherapy. What's the situation for people that have had, say, a hematopoietic cell transplant. So this study from Bevans, they're smaller studies in the hematological world, but 171 survivors, they were already 3 years post their transplant, and then they did annual surveys. And they found that the majority of them reported difficulty concentrating as one of their top physical symptoms. And this occurred in each year that they followed up the people for. So that's talking about symptoms, what we perceive as being our problems, such as what Mel described to you very beautifully. What happens when we actually do formal neuropsychological or cognitive testing on people? Well, again, most of the work's been done in breast cancer survivors, and the studies vary and vary considerably, such that it ranges from almost none to 60% of people having neuropsychological impairment when we formally test them. And there's a number of different reasons. This is after chemotherapy. So it may surprise you to know that we don't really have a standardized definition of what constitutes cognitive impairment, but it also depends on what treatment the person has had and when you test them with time from diagnosis and time from treatment. So initially, all the early work was done in what we call cross-sectional, so a one-off test, and it was always done after people had had chemo. So we blamed it on the chemotherapy. And then the first studies started coming out showing some testing done before people had had chemotherapy. And we were very surprised to find that almost a third of people actually scored lower than what we would expect. So based on, say, their age, based on their education, etc., at baseline before they'd had even a whiff of chemotherapy. And so, you know, we thought, oh, well, they've just had a diagnosis of a life-threatening illness. Is it due to depression, anxiety, fatigue? And it did not seem to be associated with those things. And when we looked at surgical factors in the breast cancer patients, it also didn't seem to be associated with that. So hence the term cancer brain or cancer fog is probably better than chemo brain. So again, looking at transplant survivors, small study, only 40 patients. But what they found was that cognitive impairment, which ranged from mild to moderate, was occurring in about 60% when they were tested between 22 and 82 months after their transplant. So they tried looking at risk factors, what sort of things were likely to be more likely to cause that impairment. It seemed to depend in this study, and I stress that because the risk factors vary from study to study, about what pre-transplant chemotherapy people had had, particularly whether they'd had total brain irradiation, what the amount of immunosuppressive therapy, and those who'd been sicker, had had a longer hospital stay, more graft versus host disease, were more likely to have problems. So I thought I'd just summarise what we do know about this problem of cancer-related cognitive impairment. It doesn't affect everybody, but it affects a subgroup of cancer survivors. For most people, it's a subtle impairment. This is not dementia. It tends to be subtle, but even a subtle impairment in cognitive function in people that have lifestyles that require high cognitive ability can be very noticeable. It tends to be a frontal subcortical impairment, whereas dementia is more of a cortical impairment. That's subcortical is just deeper parts of the brain that are affected. And we particularly find that it affects memory, processing speed, so how quickly you can sort through a problem, and executive function, which is like multitasking. What we don't know, we still don't have a clear idea of the incidence, so how many people are affected and the duration, so there's more information on that I'll share with you. We don't have a clear idea of the cause, but it's likely to be what we call multifactorial. In other words, lots of things are contributing to this. It may well be direct toxicity from the chemotherapy, and certainly a lot of animal models that we have strongly suggest that. Cytokines are inflammatory markers, and with a cancer, there's increased inflammation around, and they seem to be causing some damage. Particularly breast cancer patients, it was thought early on it may be due to changes and abrupt changes in the sex hormones for women in particular, but also for men, say, in prostate cancer. Was it due to tiny little micro blood clots in the brain? And there certainly seems to be some data suggesting a genetic predisposition, and there is a particular allele called ApoE, which actually predisposes people to Alzheimer's disease, a particular type of it. And there's suggestion that if you've got that particular allele, you may be more likely also to have problems with chemotherapy. So risk factors, I will address a few more of those. And one of the problems is we don't actually know the best, we don't know how to prevent this, and we don't know the best way to treat it when it occurs. So as I said, early on studies were just a one-off testing. And I'll just briefly share with you some of the earlier studies that first started to look at people over a period of time. Again, this is in breast cancer, but why it's helpful was these people were tested before they'd received any chemotherapy or had surgery. And again, they found almost a third had cognitive impairment before they'd done any of those things. They tested them again at the end of chemotherapy, and basically half the people's cognitive scores had stayed the same. A quarter had improved with time finishing chemo, and a quarter had declined. And this next study is also in breast cancer. It's a small study, but it was one of the first to show that maybe that there can even be some deterioration after finishing chemotherapy. So how long does it last? Well, apologies, this is again in breast cancer because that's where the data is. This was in women that had had chemotherapy with a chemotherapy regimen we no longer use called CMF, but they were tested 21 years after having had their chemo, and then compared to a really large group, this is a Dutch study, of women that had never had chemotherapy and had never had cancer. And those who'd received chemotherapy did worse on a number of different types of memory, on processing, and also executive function. They did have more cognitive symptoms, but interestingly, they actually had less depressive symptoms than people that had never had cancer. I'd like to share with you our large study, which is in colorectal cancer, because it's men and women, and it's actually the largest study that's been published using comprehensive testing. And this is basically the crux of the study. So it was in groups of people predominantly that had localized colorectal cancer. So their colorectal cancer was curable. And this is for 173 that did receive chemotherapy after baseline, 116 that never required chemotherapy, a smaller group of 72 that had more advanced disease but received chemotherapy, and then 72 healthy controls. And they were assessed from baseline to 2 years. And the really striking thing is if you have a look in all our chemotherapy groups in this, the blue lines, which is before they'd received any chemotherapy, what you'll see is that an average of 43% had cognitive impairment compared to only 15% of the healthy controls, which is about what you'd expect, 10 to 15% in the general population. And if you just quickly look across the time frame, you'll see that at every time point, the cancer patients had more cognitive impairment than the healthy controls. But one thing that was striking in this group, if you compare this group to this group, there's not much difference. And there was no difference at any time point in whether or not they'd received chemotherapy. Looking at their cognitive symptoms, the groups are the same here. If you look at baseline, so pre-any chemotherapy, there's really no difference between the groups. This royal blue on the end is the healthy controls. At 6 months, the two groups that received chemotherapy had much higher rates of cognitive symptoms. That persisted at 12 months, 6 months after they'd finished chemo. By 2 years, there wasn't much difference between the chemo patients and the non-chemo patients. What we found, and what almost every other study has found, is that associated with cognitive symptoms are higher rates of fatigue, more anxiety and depression, and poorer quality of life. But none of those variables, including cognitive symptoms, is associated with what we find when we do formal objective cognitive testing. So just to sort of bring that home, the cognitive symptoms are not related to what we find on formal testing. We've now looked at a small group of those patients from that initial study, because remember, we'd followed them out to 2 years. And we wanted to see what happened, 6 to 9 years later. So we've tested some of them. We added in some extra tests, and this fits in with what Mel was saying, what we call functional assessment. So we tried to simulate real world tasks, shopping, financial management, cooking, medication, and a driving task. And we also added in an optional brain imaging where people go in a scanner while they're actually doing a memory task. So our cancer patients were an average of 9 years post their diagnosis or post their original baseline testing, but between 6 and 12 years. The healthy controls were a bit less because they joined the study a bit later. And 9 of the 25 colorectal cancer patients had received chemotherapy. So our study sample is smaller than we would have liked, but interestingly, or the good news is that we didn't find a difference in their cognitive results between the cancer patients and the healthy controls at that long-term follow-up. We did not find evidence of accelerated aging. We wondered whether things, the normal aging process that occurs for everyone was occurring quicker in the cancer patients. We didn't find that. And we didn't find a difference in those functional real-world testing. We did find some differences in neuroimaging, but it's a small study, and that needs to be repeated in a larger study. However, all the people in this scored better than what the big group did from the original study. So it's possible that those who had the biggest problems declined to participate in the follow-up. So it may be a case of self-selection there. So a little bit more work on risk factors. Again, this is in breast cancer patients, but they found that if you are higher age, if you had a lower cognitive reserve to start with, or you'd received chemotherapy, that people were more likely to have a decline in processing speed after their cancer and chemotherapy. This is one of the largest studies in patients that have had transplant, and what they found, 100 patients, they did testing before the transplant, at 100 days, and at 12 months. And they found that up to half scored lower than they would have expected on the tests pre and post their transplant. Now, bear in mind that we don't have testing on these people before they got sick. So we have to compare it to what we would expect based on normative data, which is based on the general population. And the areas that were particularly affected were word fluency, fine motor function, and verbal delayed recall. There was some improvement with time, but 16% actually declined from baseline to the 12-month mark. And unlike the earlier study that I showed you, there was no association with conditioning intensity, whether or not they'd had total brain irradiation, graft versus host, other things like length of stay. But there was an association with increasing age and also with people's intelligence, natural intelligence pre their disease. I've included this study here with thanks to Priscilla Gates, who is a researcher who has literally just submitted this work for her PhD from Peter Mac, because it's looking at this cognitive impairment in problems with, in patients, with really aggressive lymphoma who have had to start treatment very quickly. And it was to see, can they do comprehensive cognitive testing, and also looking at trying to get them to also do some scans, brain scans as well. So Priscilla looked at 30 patients, and it's a feasibility study. So she looked at baseline testing at during the middle of their chemotherapy and post chemotherapy. There are only 9 of those 30 where they were eligible and able to do the brain scans. And she also did more in-depth interviews with the majority of the patients. So at baseline, she found that there was cognitive impairment in between 20 and 33% of them in most of the cognitive domains that she looked at. And she found that the participants did do worse compared to population norms. So what you would expect them to do at baseline and follow up, particularly attention, working memory, learning memory, information, speed of information processing, and executive function. They had more cognitive symptoms. They had more fatigue at follow-up than at baseline, but their anxiety and depression symptoms improved. This is probably the largest study that I'm aware of that's been looked at in patients that have had transplant. 278 heme patients at baseline 6 and 12 months. And they looked at predictors of objective cognitive performance. So the pre-transplant risk factors more likely to cause cognitive issues were cranial irradiation or intrathecal chemotherapy. The risk factors around the transplant were if it was allogeneic and an unrelated donor. And post complications were severity of graft versus host and mucositis and gastrointestinal inflammation. So just very quickly, there has been a fair bit of work more recently in brain imaging studies. And again, it's nearly all in breast cancer survivors, but it has shown that if you compare people that have had chemo to cancer patients who haven't had chemo, that there is a small reduction in the grey matter volume and problems with some of the white matter in the brain. And then in studies like ours, but larger than ours, that have looked at people doing testing, memory testing, while they're in a MRI machine, we find that there are areas of the brain that don't work as well, and there's others that seem to be working harder. Now, we think the ones that are working harder are actually compensatory. And this might explain why people have symptoms, but they doesn't correlate or associate so well with what we find on objective testing. And it may be that they're aware that they're working harder. And they're bringing extra areas of the brain into play. So I don't expect you to be able to read MRI scans, but if you have a look, this one here is people who've had chemotherapy people who haven't had chemotherapy. And just look at these areas that light up, and you'll see in the chemotherapy, there's less areas lighting up while these people are doing a memory task. So what can we do about it? Well, there has been a number of studies, some of them only in rats, I might say, but some in humans, looking at these different drugs. And the bottom line is none of them are ready for prime time at this stage. Same with a study looking at ginkgo biloba. The best evidence at the moment is actually for exercise. And the studies here have involved yoga, internet exercising, and also getting people to exercise at home. And all of the three showed improvement in cognitive symptoms. They may not actually be improving, though, the actual objective cognitive test results, but improving symptoms is important. There's also what we call behavioural interventions, and these generally focus on, can we improve the underlying problem? And I'll talk in a moment about one of our studies in brain training. Or can we teach people better ways to cope with the underlying problems? And this is something Pippa's going to speak a lot more about. So this study was Victoria Bray's a medical oncologist, and she did this as part of her PhD with me. And basically it was for solid tumour cancer survivors. We had 242 who had cognitive symptoms between 6 months and 5 years after their chemotherapy for early stage disease. And they were randomized. So half of them got a brain training program called Brain HQ or Insight, and others got a control group, the other half. And basically on all different types of cognitive symptoms, there was improvement. So this goes from before they started the program, the cream color are those who did the brain training, the orange are the controls. T2 is after finishing, and then T3 is 6 months later. So improvement. However, we didn't find improvement on the objective testing. So in summary, cognitive symptoms are very common, probably affect 60 to 70% of people that are on chemo, but you don't have to be on chemo to have had them. Objective cognitive impairment occurs in a subgroup of people. It's not just chemo brain. It can occur with just having cancer, and also hormonal treatment, immunotherapy, certainly radiotherapy, particularly to the brain. There's a lack of association between what people report with cognitive symptoms and what we find on formal testing. But the objective impairment is not associated with fatigue, anxiety, depression, or quality of life. We still don't know what causes this, but there's a suggestion that chemotherapy certainly contributes to it. And at the moment, the most promising interventions are a form of cognitive rehabilitation and exercise. If you want to learn more about it, I've done a podcast with Julie McCrossan for the Cancer Council, which you can pick up on their website, and we've also prepared a fact sheet on that. And just acknowledging my research team and my funders. Thank you very much.
Thank you, Janette, for your insights. I think it's very useful for people to have a bit of an understanding of what research has been done. And, you know, even though it's not necessarily specific always to blood cancers, that there is stuff going on, and that, you know, it is showing something that validates that this is real, that it does happen to people. And although we may not have all the answers, it's being looked into. So turning now to how we might manage this, I'd like to introduce our next speaker, Pippa LaBuc. So Pip is an occupational therapist who has worked in the cancer field within the UK and Australia for the past 9 years. She worked at Guy's and Thomas's NHS Foundation Trust in London for 8 years, where she honed her skills in the cancer care prior to returning to Australia in 2021. Pip has worked both across oncology and haematology sector, specialising in cancer rehabilitation and symptom management, and she has presented at multiple international conferences on these topics, including the World Conference on Lung Cancer, the European Lung Cancer Conference, and the British Geriatric Society Oncogenerics Conference. She's currently working as an education and vocation consultant at Peter MacCallum Cancer Centre in Melbourne, where part of her role is looking at implementing a program for the management of cancer-related cognitive impairments within the Victorian Adolescent and Young Adult Cancer Service.
First of all, thank you so much for having me today. I'm going to hopefully be talking to you about how can we have some really simple tricks and tips to help you clear that fog. So what I'm going to be focusing on is really about strategies that you can go off and hopefully use following this session and try them out and see if they work for you. So, oh my God, no. So the impact of cancer-related cognitive impairments, it differs from person to person, and what it depends on is obviously what type of treatment you've had and what your diagnosis has been. But like our previous speaker said, for most people, they'll experience changes in both their memory, so this can be long-term or short-term, your attention or focus, problem solving, multitasking or planning. And so a lot of people describe it as, having this fog or that their brain is feeling slow, and it can impact on so many areas, like Mel described beautifully in the first presentation. So, around our ability to socialize, our ability to do work tasks, study, day-to-day activities, communicate, all those areas can be impacted by this. So the management of cancer-related cognitive impairments, and I will keep saying that long-term, I'm sorry, but like Janette has just said, it's a really growing area of research. And unfortunately, we don't have solid evidence about, specific strategies to use or specific approaches. But one of the key things to do is look at compensatory strategies, like Janette has just said. So unfortunately, whilst these won't remove the changes, what they can do is they can help you sort of feel more in control of them, feel like you can manage them, take back that control, which I think often people report to me as one of the biggest challenges. They say, I just don't feel like I know how to manage this. There's no patterns, there's nothing that works, and it can just feel like you've had something sort of taken away from you. So finding ways that you can feel like you're taking control is really, really important. And often these are going to be little sort of easy, simple wins. So like simple little strategies that you can do. And the best way to do it is by looking at various strategies like we'll go through today, and then figuring out which ones work for you. So what works for me isn't going to work for the next person. It's about going through and cherry picking what works for you and then having them there in your toolbox to use and ready to go whenever the incident arises. And one thing I would say is, once again with this, is think about what specific strategy you'll use in which situation. So what you might need for work might be different, say, when you're driving the car. So it's really important to be quite specific about where you'll use various strategies. And the best way to figure that out is a bit of trial and error. So we also want to look at how can we sort of identify what makes your cognitive changes better or worse. And we also want to have a think about sort of some of the stress factors that impact on this. And I know there has been some questions around the impact of anxiety and stress, and we do know this has a really big impact on our brain's function. So we will cover that. And I know it's so much easier me saying, don't worry about it, don't be stressed, than it is actually feeling that way. But hopefully we can go through some strategies that help will manage that. And then also the other thing is feeling comfortable and confident with how you communicate your changes and your needs to those around you. I think one of the biggest challenges that people always report to me with this is that, it's all internal. No one can see it. And if you had, say, something like a broken arm, you could be like, hey, here's my cast, people know what's going on. Whereas with these changes, they're internal. And so finding ways that we can communicate what's happening and what our needs are is really, really important. So the first step I would always suggest is thinking about what are your triggers. So what are the things that are going on and make your changes to your brain's functioning worse or better as well? So things that might be worthwhile thinking about is it noisy? Are you tired? Are you hungry or in pain? Hunger is very, very real in this situation. Are there certain tasks that you have difficulty with, such as, working for long times on your computer or having long conversations? Take a really, really curious approach with this. So take a nice chance to step back and be really, really curious about what is going on when you're finding you're having these episodes of, say, forgetting or, difficulty concentrating. It can be really helpful to also even take the time to write these down so that then you can start to identify what kind of factors are going on when you're feeling like this and look at ways to eliminate them. I would say that if any of your symptoms or any of your sort of episodes of forgetting or difficulty concentrating happen because of another symptom that's going on, it's really, really important that you let your medical team know, because then they can look at what sort of input they can be providing to manage this. And so we wanted to try and eliminate any additional causes that we can. It's also good to have a think about, like I said, what makes it better. So do you feel better after you've eaten? Do you feel better after you've had a rest? Do you find you can focus a lot more after going for a walk or doing some relaxation? A lot of people will already be having these strategies that they use. So I'm sure most of you have sat there and gone, oh, actually, after I've really had a nice chill out, just sitting in my comfy chair, having a little bit of a downtime, I find I can go back to doing a task and focus more. This is a brilliant starting point. So you'll already have most likely some things there that are your starting point. And I think it's really important to think about that, what you're already using. So like we said, one of the things that we do know that really does impact on our brain's function, and particularly its processing speed, is when we're feeling stressed or we're feeling anxious. And this is related to the impact of the hormones that are released when we're experiencing stress or anything that our brain kind of perceives as stress or a threat. And so these hormones are designed to prepare our body and our brain to either fight or run away from the threat. So the fight or flight response, which I'm sure lots of people have heard of. And the other thing that they do is they speed up certain parts of our body and our brain, and then they slow down other aspects of our body and our brain. And when it comes to our brain, this is particularly around the areas responsible for our problem solving, our planning, and our recalling of information. So this is this super old basic human instinct is controlled by the oldest part of our brain. And it's absolutely fabulous if we're needing to run from a threat. So, back in the days, saber-toothed tigers coming to eat you, you need to get away. Nowadays, trucks coming towards you, you need to jump out of the way. However, for simple little, I'm not going to say simple little basic things, but for maybe less immediate threats, like forgetting someone's name, it's not so helpful. And so what we want to think about is sort of ways that we can help to reduce some of this stress. It's also really common that when people are experiencing cancer-related cognitive impairments, that what they can do is start to attribute any memory fault or difficulty focusing on their cancer and their cancer treatment. And whilst this definitely would be the case in some incidences, there is also that element of normal forgetting. And what is normal forgetting? So for most people, when you think, even before your treatment, I'm sure you've had times you've walked into a room and then you're like, what am I doing here? I can't remember or can't recall what I'm here for. And that is just normal. And when we actually look at some evidence that there's been some studies done comparing the impact of cancer-related cognitive impairments and sort of symptoms people report and also normal forgetting, there is a really strong correlation over that. And so whilst it's very easy for me to sit here and be like, hey, don't jump to conclusions every time, starting to maybe do some of that thought challenging when you do have a sort of a memory slip or something like that, going, okay, is this cancer related, or could this just be a bit more of that normal forgetting? And the reason we want to try and do this is not to say that you're wrong. It's more so to try and reduce that stress response that then releases the stress hormones, which then slows down our brain's processing speed even longer, or even more, sorry. So some really easy ways, or some good ways to be thinking about this, is things like relaxation or mindfulness. So I'm sure a lot of people here have heard of both relaxation and mindfulness, but for a lot of people, it can seem like quite a foreign concept. It's not something we usually allow ourselves lots of time to sort of sit down and properly switch off. However, once again, there's a lot of evidence, like Janette said, there's evidence out there to show the use of these strategies in helping to reduce our stress levels and help with the brain's processing speeds and also its focus. So there is, this isn't just, a lot of people I suggest this to think it's sort of, some hippie kind of thing. It's not. There's very good evidence for this. So there's two main approaches when we think about this. There's mindfulness, which is kind of a lot more of the new kid on the block. So I'm sure people have heard of this, but sort of thought, well, what is actually mindfulness? And to break it down really, really basically, mindfulness is just making sure that you're really present in the moment, and that sort of stops any other intrusive thoughts or worries or stresses coming in. And there's two ways we can do this. We can either go with passive mindfulness. So this is where we sit, we do a specific script or a grounding exercise. Often these are done through apps or the internet, or someone can read it to you if they're nice. And this is a way that you can sort of do a nice exercise. Otherwise, for the people that feels a bit foreign for, there's active mindfulness. And this is just where you're doing something you love and you're really in the moment and really focused. So I don't know if we have any sort of people that are gardeners on the line, but I don't know if you've ever found yourself that you go out in the garden, you're like, I'm going to just sort out this part. 2 hours later, you don't know where the time's gone, but you've just been really focused on the task, having a lovely time. That is active mindfulness. And so for a lot of people, actually going off and doing something they really enjoy can be a nice way just to give your brain a bit of a switch off. The other one is relaxation. So this can be things like meditation or breath work, so controlled breathing strategies, or things like muscle relaxation, where we slowly work through the body and release the muscle tensions. So once again, the whole idea of this is that we try and reduce that stress response. We reduce the stress hormones from building up and then slowing down our brain's processing speed. And we're going to include a few nice resources, some links to the resources in the chat for you. So you can go off and have a little bit of a look at some of them if you're interested. Another good tip to use is sort of having a routine. So this can, once again, help to calm our brain as it avoids it needing to have to constantly think about what we're going to do, remember information. And also there's good research out there using things like functional MRIs that our brain finds routine really reassuring. And that's what we want. We want to calm it all down. So this can either be through things like using a weekly structure, such as a diary, to provide you sort of with a bit of routine, or leaving specific items in the same place each time. So whether it's leaving your keys in a bowl at the front door, so you don't need to recall where they are. If you are going to use a diary or calendar to plan out your tasks, it can, once again, be very helpful in making sure that you've got your routine, you're not trying to overpile yourself with things to do. And it's important that you leave it somewhere you're going to see. So once again, it's not going to be an extra chore for you to go off and find it. So whether that's having a wall calendar right next to where you make your morning coffee, so you know each morning you're going to pop there, you're going to see it, you're going to know what you've got on. If you're going to be, once again, using a diary or a calendar, I would really recommend using pen and paper. There's evidence that shows that when we actually write things down, that they're going to be more cemented in our brain. It's another step to help us sort of cement that what we need to do, or that idea. And the joys of a pencil is we can rub it on out if we don't achieve it or we don't do it, and it stops things being messy and scratching out, and once again just adding to the confusion. And these sound like very simple, silly tips, but they all add up to be really helpful. It's also good to be realistic with what you're going to set yourself to do. So often, particularly people that I know that are working or have super busy lives, really common that people start to run themselves up, big to-do lists. And to-do lists are fabulous if it means that you can sort of set yourself some time to do the task, but making sure you actually set yourself a specific time to do it and set a realistic amount of time. So you're not adding to the pressure of what you need to do. Once again, I would say looking at more so scheduling your tasks rather than running a to-do list is the key thing here, because I don't know if anyone else, but I know for me personally, I start running a to-do list, it gets to like 20 items deep. And then every time I look at it, I just think, oh, I haven't achieved any of that. I got to add 5 more things, and it mounts and adds more and more stress. And we don't want that. We want nice and calm. So they would be some of the things you can do around scheduling. Prompts, kind of leading from that, once again, prompts are really, really handy. And the idea of these is that you use it for key specific things that you forget or things you want to remember, and place them somewhere you're going to see. So you can either use things like a phone reminders. So they're fabulous for if you need to remember what time to take your meds, if you need to remember what time to pick the kids up from school, if you need to remember meetings. Having things on your phone to remind you is really, really helpful. And a lot of people I meet say to me, oh, okay, well, I don't want to use that because isn't that cheating? Isn't that going to slow my brain down? And actually, we know that that's not going to happen. Actually, it's going to help your brain probably function better because it doesn't need to recall this information, and you've got it right there, and it takes the stress away of thinking, oh, what was that thing I forgot? Post-it notes are fabulous, but I would say, once again, we want to avoid the house being covered in post-it notes. So I've met some people that are like, I've got a post-it note every single where certain containers are, where things are in each room. That becomes overwhelming. Our brain won't take it in. It won't think that there's something special to remember. So using it in specific environments and specific things is really helpful. Which leads nicely onto the environment. So this isn't something we always think about with what can help with, improving our brain's function. But we know that the environment can have a huge impact on our thinking and our concentration, and particularly around sort of working roles or with driving. So the more distractions that we have, the harder it is for our brain to focus on the one task that's going on. And so if you think about, if any of you have ever, I imagine most people have been in a busy shopping centre at some point at Christmas, and you go in there, you're like, I've got to get that one thing. 5 minutes later, you don't know what you're there for, you can't remember, there's music, there's people, there's smells, there's everything going on. It's overwhelming. And for a lot of people who experience cancer-related cognitive impairments, this is what everyday work or everyday family life can feel like. So we want to look at ways that we can reduce that distraction or the sort of the sensory overload that then makes our brain struggle so hard to focus. So one thing we can think about is, how can we reduce noise? So can we be wearing, say, headphones when we're at work or studying? Or is it where we sit in the room? So, if we're out at a pub with friends, can we be at the end of the table so we're not trying to take in all the conversations going around us, like surround sound? Or can we be sitting in a corner desk at work? So once again, we don't have that sort of surround sound, surround distraction going on. Thinking about things like lighting. So if it's dark and you've got to like focus harder, you're trying to see, find things, or even, trying to read in the dark, brain uses up more power. If things are cluttered, if you're needing to look for things and it's a schmozzle, that's going to make things much harder. The other thing to think about is also the time of day. So particularly if you're driving or you're traveling to work or traveling to school, can you travel outside peak hour? Because obviously when we're doing in peak hour, we've got to focus on everything that's going around us. It might be that you've got to sit in traffic for longer. All these things take a lot more of our brain's function, and it tires our brain out. But also things like, can you go shopping, say, when it's, not a weekend, so there's not so many people around, and once again, that's sensory overload. Now, can't do this talk without mentioning fatigue, because as Janette said, fatigue is, we know there's a correlation there. So fatigue is also the most common symptom that anyone with a cancer diagnosis experiences. So it's something between 70 to 100% of all people with a cancer diagnosis experience fatigue. And we know that there is a really good crossover between fatigue and our brain's functioning, so particularly around memory, attention, and our thinking. Fatigue, often when we think about fatigue, we think about the physical impacts, but also we know it does impact on us mentally. And so this, once again, is around that idea of sort of how we can manage more complex problems, our brain tiring out when we're doing problem solving, or if we're having to focus on a task for a longer period of time. So one of the, and I'm sorry, this is going to be super short on fatigue because it could be 3 hours long, but one of the key things that we always talk about with fatigue is pacing tasks. And so stopping before you start to feel more tired or start to feel the fatigue coming in. When we're talking about mental fatigue, the time we want to stop is when we're starting to lose focus, we're starting to get distracted. So trying to stop before you get there. Also thinking about how you can recognize your triggers, so what makes it better or worse, and using things that you know make your energy levels feel better to help boost your energy levels. Sleep is another issue. We know it's a big problem for people who, when we're not sleeping well, our body doesn't get that chance to repair and restore or process all the new learning. There's various sleep issues. I'd say if you're experiencing any of these, please contact your medical team and they can support you to get the right assistance with it. One of the key things I really want to talk to you about is how do we learn to communicate what we need, and that can communicate sort of the cognitive changes and their impact on you. And what I would say is it's really important to take some time to sit down and actually think about how would you explain this, because if you can't explain it, it's very hard for people that aren't experiencing it to understand what's going on for you. So what I'd say is sit down, think about, how can you describe your experience? So what makes it better? What makes it worse? What strategies do you find helpful, and in what situations? What tasks do you feel more confident to complete? And this is particularly for work and school. And what can other people be doing to help you? I'd say particularly for work, having clear communication pathways with your manager, and also reviewing these regularly, because your fatigue, not your fatigue, that too, but your cognitive changes will fluctuate. So making sure that you're reviewing this really regularly. People are there to help and they really want to be able to help you. So sort of learning how you can express your needs can really help reduce some of those relationship tensions that can occur. Who's here to help? There's lots of people here to help. Your medical team and your nursing team, your allied health services, friends and family, and also there's some really good resources through the Cancer Council and the Leukaemia Foundation. As Janette mentioned earlier, there is a big correlation between the use of physical activity and cognitive changes, and also nutrition and just general health. And the Leukaemia Foundation will be putting on some webinars on these later in the year. So I really recommend everyone calls into those and joins in. So the key messages: your brain fog or your cancer-related cognitive impairments is real. And I can't say this enough. Whatever you think, whether you think you're lazy, you're crazy, it's not there. It is. The evidence is there. Hopefully that's one thing you take out of this. Also remember, you're the expert. What you experience is going to be different to anyone else, and no one knows what you're going through better than you do. So feel confident to be able to speak up. Use quick little win strategies. That's where we're going to get hopefully some good outcomes. Be kind to yourself. Don't beat yourself up. This is real. This is what's going on. And where possible, let others in. Let them take the load off your shoulders a little bit. So, thank you.
Thank you so much, Pippa. I think it's really good too that you again validated it's real. It does exist. You're not imagining it. And I really like the way that you broke down the strategies. You didn't just say, do this, watch your sleep. You sort of said, like, delved into it a little bit more to sort of help people see what they really can do in little steps to make things, hopefully a bit better. I'm going to hand over now to Jenny, who's going to do our Q&A for us. So take it away, Jenny.
Thank you. Wow. I'm just going, wow. So much incredible, valuable, rich information from Mel's personal experience that was borne out in all of the research that Janette was talking about into Pippa's presentation on how to manage it on a day-to-day basis. And I think the questions that you've all submitted absolutely tell us that this is a huge issue for you. It's something you live with every day, and the questions have been phenomenal. So I'll get through what I can. I think I'm going to start with a really important one that doesn't come up very much, and that is for people that have had treatment for cancer as a child. how might that impact on them as an adolescent and then potentially as an adult? And Pippa, I'm going to throw that to you because of the work that you're doing in the population that you work with.
Yeah, thanks. So there is definitely evidence that, and there's a lot of research that has been done into this, particularly around the hematology side of things, around the impact of having treatment as a child and then the long-term cognitive effects of this. And so it all really does depend on your treatment, but also the age you are when you have your treatment, because the way our bodies and our brains work is they mature at different stages. So depending what age you are when you have your treatment is going to depend your brain's maturity at that age and sort of then impact on developmentally as we go forward. So I don't know the exact statistics, I'm sorry, but there is really clear mapping of actually the treatments and the developmental stages and then the long-term effects of these. And it definitely is very real. It definitely does impact on you long into your life for some people. Some people it doesn't, which is fabulous. But it is there is a lot of evidence to show that this is the facts. Yeah.
Yeah, and a follow-on question from that I think Mel talked about so beautifully was that impact on what Janette explained in the research, which is about that executive functioning or that multitasking, that ability to do things that require us to hold multiple pieces of information in our head. So we had a lot of questions around how people can manage their daily tasks, like driving and studying and writing essays, where you've got to hold a lot of information in your head while you're actually doing the tasks. So I might start with Pippa to talk about some practical strategies and then perhaps move on to Janette about what the research says around that multitasking.
Yeah, so I would say, unfortunately, there's no set specific strategies. What I would say is that it's once again going back and using some of those things that we talked about before. So making sure you're writing things down, keeping notes, using reminders. I would say one of the key things is not also pushing yourself, so not working for long periods of time trying to push through, because once you start to feel fatigued, that makes everything, all your brain's functioning and processes harder. So it's actually doing set smaller amounts of time, so little and often almost, but then using prompts to help bring you back to where you were. And the other thing I would also think about is there a time of the day that your brain's function feels like it's better? So are you a morning person? Are you an evening person? Try and prioritize those more challenging, more complex kind of brain cognitive function tasks at those times of day when your brain's going to be working at its optimum.
Thanks, Pippa. Janette, have you got anything to add around perhaps some of the research around that multitasking or things that people find are helpful? Or
the research certainly shows that multitasking or executive functioning is affected. What we don't know is how best to treat it. So I think Pippa's suggestion of basically breaking the tasks down into smaller tasks and the other compensatory strategies that she gave for that is excellent advice.
Another one for you, Janette, and it relates a little bit to a lot of the research you were talking about, which was how someone might distinguish a symptom between being a cognitive process, a normal aging process like menopause, or an abnormal process like dementia, and perhaps a mental health issue more like depression. So how would they try and tease that apart, or who would they go to help with that?
It can actually be very difficult to tease apart because all of us have memory lapses. We all have lack of attention. So it's common that if you have had a cancer that you may think, rather than is this what everybody else gets, that this is due to the cancer. And it may certainly well be. So I think the main thing is that it's good for your medical teams to address things that are reversible. So we know that fatigue is associated with more cognitive symptoms. There's good evidence that the best treatment for fatigue is actually exercise, but it's got to be gradually improved. You can't suddenly do too much or you'll get like a bust and boom sort of cycle. So it's reversing the reversible things, trying the strategies, having the team assess for anxiety and depression, and if they're present, to treat those. And if there clearly are problems with cognitive symptoms, or there is even evidence that there seems to be impairment, then I think it's good to request for a neuropsychological assessment. So this is a formal cognitive testing. They are available through the public hospital system. However, there is definitely quite a time factor associated with those. But where you're really concerned about it, I would ask the team whether they, after looking at reversible causes, to consider for neuropsychological assessment.
Thank you. And that sort of covers off, I guess, one of the questions, which is what tests or tools can help detect that loss. So it's a combination, isn't it, of things that we've looked at. I think one of the other ones that comes up quite strongly for people is the impact on their quality of life because of this. So how do you recommend people advocate for themselves with their teams to get the help they need when it's, sometimes the focus is on saving a life, and we forget sometimes what the impact of that might be down the track. So, Janette, I'll start with you. Do you have any suggestions about how people can advocate strongly for themselves in this area?
I think one of the problems in the past is that it's something that many of your oncologists or hematologists probably won't ask you about, whether you have cognitive symptoms. And part of that is because we as oncologists or hematologists don't know how best to treat it. So I would certainly bring it up and make sure that they're aware that you are having cognitive symptoms, if that's the case, and fatigue. Sometimes patients feel that, well, I should be grateful I'm alive and these are minor things, but they're not minor when they're affecting your quality of life. So I think it's important. Hopefully doctors are asking more about it, but it's important that you put it out there that this is an issue. And I would bring it up each time and say, is there something that can be done about that if it's affecting you and affecting your quality of life?
Thanks. Pippa, have you got anything you'd like to add about that?
I mean, I think Janette summed it up really nicely. And I think the challenge is that, often if you're not being asked what's going on for you or asked those specific questions, you sometimes probably don't feel like confident to bring it up or think, oh, this is just part and parcel. A lot of people I meet go, chemo brain, we know about that. That's going to happen. It's just a side effect of the treatment. But it's a horrible side effect of the treatment. And so I think, as Janette said, making sure you speak up, don't feel like you need to just put up with it. But I would really go back to, before you do, think about how you want to explain it. Think about what specific things it's impacting, because I think that always gives a better example and it helps people understand actually how much of a detrimental impact it's having. Because if you just say, oh, I'm having difficulty with memory, it's easier for people to brush that aside. Whereas if you say, oh, I'm having problems with memory, I've done these things, or it's worrying me, or it's, causing a big distress to me, hopefully that will grab people's attention a bit more. And it shouldn't have to be that way, but I think anything that helps is good.
And it's good to write yourself notes so that when you get into the consult in the heat of the moment, you don't forget, and then consult it before you leave to make sure that you've covered your main things.
Good point. Pippa, the other question I had for you related to that, for those of the people that perhaps are a long way past treatment that might not be as in close contact with their treating teams anymore, what resources are there at universities or workplaces that people could use to start that conversation and get the help they need? Is there anything?
I mean, most, particularly universities, are fabulous. They're really well set up. If you are studying and you're experiencing this, I would definitely get yourself linked in with there, for want of a better word, there's going to be a disability service at your university. And they will be able to set in place sort of study plans that will assist you and make sure you've got the right strategies and the right supports in place. Works should have someone that can assist with that. So whether that's your manager, getting in touch with sort of HR or something like that. There are also obviously workers' rights around what strategies should be implemented. And so familiarise yourself with these. But if you can't, or if that isn't sufficient, then I would say reaching out to your GP, reaching out to, there's a lot of resources available through, say, the Cancer Council as well. But I'd say, particularly work and study, they would be the best places to start.
Fabulous. I know a lot of people have commented that they feel dismissed or that it's minimised or it's just something you'll get over, and it's a very real thing for people, and it's even for people that are aware they need help, it's a frustrating thing. So this is a bit of a curly one, but I'm going to put it out there. Based on your clinical experience with people, how would you suggest people manage or deal with that feeling of never being quite themselves anymore, or that things have changed and they have to make quite a big adjustment to perhaps the way they feel about themselves, or do the things that are important to them? I might start with you, Janette, which is a bit mean, but
I think it's a really big concern, and for many people, it's a matter of adjusting to an extent to what becomes for them the new normal. Now, it doesn't mean that that's as good as it gets, but accepting that there may be changes that are not going to go back to baseline, and then looking to see what things are reversible, what things can be helped. So, for example, if it's with the cognitive symptoms, again, looking at, is anxiety or depression an issue? They will help the cognitive symptoms. Is fatigue, sleep an issue? Yep. Bringing in compensatory strategies, perhaps trying some brain training and seeing if it helps. And so little things, but part of it, as Pippa had said, is, and Mel had said, is accepting that it may not be back to what was your previous normal. And part of that, as you also alluded to previously, will just be that with aging, our brains are not as good as what they were 10 years ago. Menopause, all those other things that also are sort of pushing us to where our cognition is not going to be as good as what it was in our 20s and 30s.
Yeah, really helpful advice. Thank you. We forget we get older.
Yeah.
Pippa, is there anything you'd like to add before we wrap it up? We could sit here and talk for an hour. We've had so many fantastic bits of information, so many questions. But Pippa, is there anything you want to add before we wrap it up?
I guess, I think once again, Janette said it fabulously. The only things I guess I would add is it's really important to also, because yes, it is really challenging, but also maybe taking some time to reflect on what you're still doing and what you're doing well, because I think it's really easy that when we're feeling that way, we can focus on what's not going great and get down and feel like we're not achieving anything, but there will still be things that you're doing fabulously. And so making sure you're acknowledging those and giving yourself that sort of, the kudos for managing, and even just reflecting on the fact that you're managing despite all of these things. And I guess also, if a lot of people I've worked with, they find that, this does have a huge impact on them from an emotional perspective. So do reach out to things like psychology and counselling. It's legitimate reason to find it hard and to go and get that right help. Like, it's not a poor reason to access those resources, and they can help with some of this thought challenging and maybe looking at strategies to let you see past the challenges.
Brilliant advice. Absolutely brilliant. I thank you so much for your thoughtful and considered responses, and looking at the chat, it seems like a lot of what has been touched on has really touched a nerve out there and resonated with the people that are listening. So I'll hand back to Linda to wrap it up. Thank you so much.
All right. Well, obviously, I'd like to thank both of our speakers. It's wonderful, a lot of information for people to take in. So I hope that, you'll take some time to process that. I'd also like to take this opportunity to thank the supporters of the Leukaemia Foundation, as without them, we would be not able to deliver events such as these. I'd like to also say, like I said, Janette and Pippa, for sharing your knowledge and expertise with us. That's great. And most importantly, to all of you living with a blood cancer who've joined us today, we encourage you to use this information to start conversations with your healthcare teams, family, friends, to help guide, your health, recovery, quality of life. Thank you very much for joining us. Goodbye.